Hi, I'm John Rehfuss. I'm a vascular surgeon with Roper St. Francis Physician Partners Vascular Surgery. Patients often come to me with very complex problems that require one or more operations, intensive wound care, a lot of office visits, and achieving that optimal outcome is only going to happen if the patient and family is totally committed to the process, and that's why it's important for the patient to trust that I am going to do everything I can to give them the best possible outcome. Patients often come to me with problems that are fairly debilitating, and if I can successfully treat that patient, then I can restore that patient's quality of life and functionality, and that makes a huge difference to that patient. I want patients to get back to doing the things that they want to do, the things that are important to them, so that they can go back to work, so that they can drive their car, go to the store, play with their children, their grandchildren. Oftentimes patients come in and can't do those things anymore because of their vascular problem. If I can fix that and get them back to full functionality so that they can do the things they want to do, then they're happy and I'm happy. Recently when I was on call, I had a patient come in with a very serious life-threatening problem that required an emergency operation. The patient survived, and this is exactly why I do what I do. It feels great to save a toe. It feels awesome to save a life.